It's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CISL 650.
Playing those mind games. Hello and welcome to Boomer Life here on CISL 650. Sterling Fox with you, and obviously with the assistance of Mr. Lennon focusing us for the hour, we're going to talk about the mind and specifically about the brain. Joining us in studio from NeuroKinetics Clinic in Vancouver is medical director and founder Philippe Souvestre and clinic manager Sonia Dale. Hello, welcome both of you.
Hello,
good morning.
Thank you.
It's nice to see you both again. Welcome back, Sonia. You're looking terrific.
Thank you. Likewise, pleasure to be here.
And Philippe, tell me about the business. Tell me about neurokinetics. Is that a medical word? Is it a corporate symbol? What does it mean?
Well, it is actually a mix of those. History shows that when I moved to Canada in 1995, I had to find a name and a flag to practice my expertise in this country. As I was not in a system and I didn't have the chance to find people to work with to start at the beginning.
So you needed a name that was going to capture people's imagination and attention right away.
Yes, and also explain and reflect the nature of my work as well. So neurokinetics relates to neurology and kinetics relates to movement or motion. And what we do actually is focused on restoring brain function. So you understand the analogies here.
Okay.
So this is the history at the start. But through time, I heard increasingly, and I was contacted increasingly by colleagues, peers of Canada and outside of Canada, relating to the results and the paradigms of my approach, whether assessment or therapeutic. And they were referring increasingly to the term neurokinetics to describe the paradigms of my medical approach. So it has become involuntarily a paramount definition of the typical approach we use and offered at the clinic.
So despite the fact that it wasn't intended necessarily to be a medical term, it was more the name of what you were going to accomplish and set up in British Columbia.
Correct.
But it has, in its own way, become a medical term.
Totally out of hand, yes.
So, but it's been, how long has NeuroKinetics been a clinic and a business in Vancouver?
Well, the clinic was founded in September 1997 in Vancouver. And it is interesting to notice that you're not certainly the first one nor the last one to ask me about the neurokinetics medical specialty.
Right.
Because it became a kind of a paramount meaning in terms of traumatology and restoring neurological issue.
Okay. And Sonia, when did you join NeuroKinetics? You've been there a couple of years, right?
Give and take, yes.
Okay.
Yes.
And in addition to running, to managing the clinic and keeping the wheels turning on a regular daily basis, how do you assist Philippe in other ways?
Just day-to-day routines and activities that go on in the clinic.
Right.
A lot of assistance with patient handling, you can say, alongside with a lot of stuff that happens behind the works, meaning the accounting side of things, the invoicing side of things. So mainly pretty much everything you can say in the clinic, watching everything.
Right. Now, Philippe, let's talk about your background a little bit because it's very colorful and, to say the least, fascinating. Obviously, your accent betrays you. You are from France. You were a medical doctor in France. You were in the French Air Force. You were a flight surgeon in the French Air Force and moved to Canada, as you said, in the 1990s?
1995.
Okay.
Exactly.
What brought you to Canada, Philippe?
Passion.
Oh, okay. About what?
To start with, passion for the outdoors. I am a mountain boy and I live not as much as I can without a nice space around me.
So you don't find countries with more wide open spaces anywhere on earth than the second largest country with this tiny population. So welcome in that regard, and very similar to your background growing up in Europe in the mountains, right?
Yes.
In the Pyrenees.
Yes.
Okay, so you gravitate towards an environment that is similar to your boyhood experiences, but there's more to it, more to the move to Canada than just our lovely geography.
Well, earthly topography as well, because Vancouver is a cross place between the Eastern world and the Western world.
Aha.
The Pacific Rim, in my eyes, is one of the most beautiful corners of this beautiful planet. And being in France, I was a kind of aware of the particular openness and natural migratory traveling habits of our, humankind pattern.
And Vancouver being one of the more traveled through locations, especially in this corner of the world, right?
That is correct, yeah.
And as it turns out, that sense of placement of Vancouver has served you well over the years, because as NeuroKinetics has evolved into a successful, flourishing practice, you have patients literally coming from all over the world to see you here in Vancouver. You chose this location well and carefully, didn't you?
It was involuntary. I had already a number of flying patients, as we call them, in France. When I was in France, coming from actually Canada, some were coming from Canada at that time, and they are no stranger in my decision to move to Canada.
Okay.
Actually. Yeah.
So now we're talking, as we indicated at the very beginning of the show, we're talking about the mind, the human brain, and specifically brain injuries. And we're going to get into concussions at some length today. But I just also wanted to talk a little about in terms of neurokinetics and the approach that you bring to the table with all of the patients you see and all of the variations of injuries that they have, because you're a Western-trained doctor, Philippe. You are from the standard orthodox medical Western approach. And yet, since you've moved to Canada and particularly chosen the Pacific Rim of Canada, you've opened yourself and your mind and your practice to Eastern medicine, to the point where NeuroKinetics in 2015 is a hybrid of Eastern and Western medicine, correct?
Totally.
So tell us, what it is about Eastern medicine that you find so fascinating and so worth bringing to the table to mix or fuse with Western medicine?
Well, the holistic aspect of Eastern medicine is well known now by everyone, and as it relies on the synergistic performance of various systems distributed throughout the body, the human body, and allowing exchanges and communication between anatomical areas and regions, which in Western world of thinking are not a knowledge at all.
Right. And yet, there's a song about the hip bone connected to the thigh bone and all that. And we that's a Western medicine song, and it's supposed to be about everything is connected. But really, you need to go to Eastern medicine to get that holistic, everything really is connected picture. Western medicine may sing about it, but they don't practice it as thoroughly as Eastern medicine, do they?
Yes. There is lots of logics in Western medical interpretation of these connections, and lots of blanks remains unexplained.
Right.
While in Oriental medicine, there is no blank much left. However, in Eastern medicine, anatomical explanations of what is going on and observed and used for assessment and therapeutic practice are not well known. So there is no perfect world, Sterling.
Mm-hmm.
It's just blending both of the best of those worlds lead us to a different stage and the next step of interpretation, which is proven now extremely successful.
Mm-hmm. Sonia, last time you were here a while ago, we talked about the fact that in many cases, for many patients, NeuroKinetics Clinic is the place they go to last. They've made the rounds. They've seen every practitioner imaginable. No one has given them any relief and or satisfaction, and eventually they end up at NeuroKinetics, and many of them end up saying to you, my gosh, I should have just come here in the first place.
Correct.
Do you ever accept patients for the first place, or do you always need people who have been around the block a few times and eventually get referred to NeuroKinetics?
No, we would love to see them the first time around. I mean, it's just basically when they contact us. When they initially make that first initial contact, make the first step of, yes, I need to get better. Yes, I want more. And they give us that phone call, and we're there to help them.
Okay, so you don't have to to do all the rounds necessarily. Well, it's worth clarifying, isn't it?
Yes, it is.
Philippe, we're going to talk a lot about concussions on this particular show. tell me, what is a concussion? Without getting too medical on me, what is a concussion?
Okay, a concussion is relatively simple to explain, but if we push the investigation a bit further, it becomes a very intricate and complex phenomenon. So let's keep it simple to start with.
Sure.
Concussion is a result of a deceleration of the head of any part of the body, or sometimes a full body deceleration, and to a stop against a hard surface.
Okay. So when the body, or particularly the head, comes in contact with a hard surface to the point where it is stopped, that is going to, is that an automatic then, with that kind of bang, that impact is going to likely produce a concussion?
That is the concussion phenomenon.
It is. That's just right then and there. That's what it's all about. So how does a person know if they have a concussion? Suppose you take a fall, or you get banged around, or you're playing sports and you got a bit of a headache, you're not feeling like yourself, but I don't think I have a concussion. How would I know?
Okay. Basic understanding of that relies on the degree of consciousness left at the time of the impact.
Okay.
We call that impact because it is extremely brief. I mean, it's a split-second phenomenon.
Right.
Split-second long phenomenon. And in the first place, and if there is no loss of consciousness, which is the ultimate complication at the time of the impact a concussion victim will experience, if there is not a loss of consciousness, it will be easy to analyze the circumstances of the trauma and come to the diagnosis of a concussion.
Okay.
Now, if there has been a loss of consciousness,
in other words, if you were knocked out by whatever hit you,
yes, and not having a witness on the scene to report on the circumstances of the accident.
Okay.
Now, we begin to talk about an educated guess, and the educated guess as the last thing you want to perform in traumatology.
Right.
Because it may lead to totally different directions with respect to the understanding of what happened, and will end up with a great manifestation of loss of times and complications too.
So I'm trying to know if I'm in a situation whereby I sustain an injury to my head, perhaps a traffic accident, a sporting event, or maybe I fell down the stairs, and if I'm knocked out, then that would probably mean, even if I sort of come to in a couple of minutes and go, oh boy, that was terrible. If I'm knocked out, I should see a doctor, shouldn't I?
Yes, that would be my first recommendation. If you have been alone and you don't clearly remember the circumstance of your trauma, just pay a visit to your GP or your closest friend's doctor, wherever you are, and it will keep you on the safe side of the fence.
Okay. Now, if I haven't been knocked out, and, in sports, for example, you take a jolt and you get knocked down, and you sort of get up, and somebody will come over and go, oh, boy, they really rang your bell that time, didn't you? And you go, yeah, gee, are you okay? Oh, sure, I'm good. But you may not be good. So how do I know after the game, that night when I'm at home, what symptoms might there be, Philippe, that would tell me, boy, that shot you took this afternoon, there may be more to it than what you thought.
Exactly. And that is a permanent risk for any type of impact one may experience. Where this is a place where the entourage will play a great role.
Okay.
And be accountable sometimes for the remaining of the story. If you are alone and you don't feel good without being able to explain it, that is already by itself an alarm signal.
Okay. So upset stomach, inability to sleep.
Anything which is unusual, considering for the previous hours, comparing circumstances to circumstance.
Right.
That should become an alarm signal.
Okay, so something that is different today than it was yesterday because of that accident, whatever it may have been, should be a clue, should be a red flag.
Yes.
That I should maybe make a doctor's appointment.
To be conservative, yes.
Okay. Sonia, what happens when a general practitioner, my family doctor, sees me, and I've had this incident in which since that happened, Doc, I'm afraid I don't feel very well. Now, it's only been a couple of days, but I really don't feel well. Would you want to take my blood pressure or do something here? So I go to the family doctor, and now you've dealt with people who have been there and back, and so what's the typical response? Typical response
is usually you need rest. There's not much that can be done. Just rest, and everything will be well. Just that's a common response we always get is nothing can be done. You just need to get rest. And that's when usually when they do call in, a lot of them is the patients that do call in, they're confused. They go to the GP, they've seen that GP, and the GP is telling them, you need to get some rest, you need to rest up, and all things will be fine.
Right.
Whereas when they give us a call, they hear that, hey, you know what, your symptoms, we can address those symptoms. And they are overwhelmed with a lot of time with joy that something can be done.
So, Philippe, not to put any aspersions on the medical community here, but a general practitioner sees dozens of patients every day. Someone comes to him and says, look, I took a shot in the head and I don't feel well. Well, get some rest. That's not bad advice.
No. Right.
But it's perhaps not thorough enough given the trauma the patient is trying to describe to the doctor.
Yes.
So what would your approach be if that person, instead of calling the family doctor, decided, because I heard you on the radio, and those people sound like they know what they're talking about, so I pick up the phone and I call NeuroKinetics, what kind of different response am I going to get?
So in general, we take the time to analyze and to hear the patient. The problem with mainstream Western medicine is the healthcare system in general, doesn't allow and give enough time to the practitioners
to problem,
investigate.
Isn't it? Sure.
That is an issue.
Right.
Yeah.
So the big thing that you offer right up front, right from the get-go, is whatever time it requires, we will try to understand your case.
Yes.
Okay, well, that's a big first now, isn't it?
It is.
Our guests in studio are Sonia Dale and Philippe Souvestre from NeuroKinetics Clinic here in Vancouver, and there's lots more ahead on Boomer Life. We're going to hear from a couple patients, former patients now, happily recovered, thank you very much, and their experience with NeuroKinetics, and we'll find out a lot more about concussions. But first, this quick timeout.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CISL 650. We're back. This is Boomer Life on CISL 650.
Welcome back to Boomer Life. The prophets of rhythm, and I changed my mind as we're talking about the mind, specifically the human brain, and our guests from NeuroKinetics Clinic in Vancouver here on Boomer Life are the founder and medical director, Philippe Souvestre, and clinic manager, Sonia Dale, is also with us, and we're going to talk to a former patient in a couple of minutes. Duane is going to join us in a couple of seconds, but we were just talking during the break. We mentioned this on the last occasion that you visited us here on Boomer Life, Philippe. Sometimes, and I've learned this from my legal friends in the personal injury business, because they represent people who have been brain injured severely in the legal context. But they've told me that in many cases, a person who has suffered a brain injury is not particularly aware of it and tend, if anything, to really underestimate the seriousness of the injury. Is this something that you find in your practice as well?
Yes, it is a constant, actually. It is one of the parameters and the paradigms of this particular condition. We have to remember that trauma is neither an illness or the result of an illness or the result of a disease.
Right.
It is a third entity which is extremely particular in the field of medical practice. Okay.
So, and this is why, Sonia, when you have people coming into the clinic for that first visit, it's something. They'll make a phone call. They'll go to the website, neurokinetics.com, and they'll get the contacts after hearing you on the radio, for example. They'll go, oh, okay, why don't we give these people a call?
Right.
You prefer, if someone is coming to you with a brain injury, that individual be accompanied by someone, a friend, a family member, something like that, for a variety of reasons, not the least of which is to back up some of the information. So if you say to that person, so how are you doing today? How are you feeling? I feel great.
Yeah.
And the family member will go, maybe not so
maybe,
much.
Yes.
And so that's important, isn't it?
Yes, it is. It's very important. And it's also for support for them. I mean, throughout the process, a lot of times what happens is, like Dr. Philippe was saying, they underestimate themselves. So when they have that moral support and they have that friend or family member sitting next to them,
right,
it helps them realize what the actual problem is and to help them address the real concerns and symptoms.
Right.
Yes.
Okay, now we're going to get you in a few minutes to walk us through the process of being brought into the NeuroKinetics environment.
Sure.
But first, Philippe, I'm looking forward to this conversation. A former patient of yours is about to join us. Duane Anderson is on the line. Duane, hello.
Hello.
How are you today?
I'm well. How about you guys?
We're doing fine. Say hello to Dr. Philippe and to Sonia as well.
Good morning, Duane.
Hi, Sonia.
Hi, Duane. How are you?
I'm great, thanks.
So, Duane, how long ago did you become a patient at the NeuroKinetics Clinic?
It was January of 2014 was the first time I went in to see Philippe at NeuroKinetics.
Okay, now what was the nature of your visit? What brought you to Philippe?
I'd been struggling for kind of several years with the ongoing effects of concussions. I'd suffered many concussions and head trauma from a lifetime of playing sports and, being young and abusing my body in general and stuff.
Mm-hmm.
And I'd been left with I'd had a recent concussion that I could not recover from, couldn't return to work from, and so I ended up reaching out to NeuroKinetics and going in there for help.
Now, was that most recent concussion, the one that kept you from going to work, was that sports-related as well, Duane?
No, that one was actually a bit of a freak accident, Sterling. I hadn't been feeling well for a couple of years, and I'd flown out east on business, and on my way back, a passenger on a plane pulled a oversized luggage out of an overhead compartment and dropped it on my head.
Oh, ouch.
It was a bit of a freak accident, yeah.
But that aggravated an already existing situation.
That is exactly what it did. The actual impact wasn't that great, but it did aggravate some symptoms and some troubles I was already living with.
Now, Duane, you said that you had been feeling poorly as a result of all of this sports activity and so on for a couple of years before you went to see Dr. Philippe. Had you seen other medical types in that 2-year period?
Yeah, I'd been in to see several doctors with and kind of present my symptoms and try and get some help. And what had happened there is I think, people were pretty well-intentioned, and there was kind of two streams that kind of resulted. One was, if I'd had another concussion and stuff, it was the rest and time will make it better. Or the other one was well-intentioned people kind of misdiagnosing you. I had a lot of symptoms, so I was misdiagnosed with problems with my neck, problems with my back, heart problems, all sorts of issues, right?
And so by the time you finally got to the NeuroKinetics Clinic, you'd sort of bounced around a little bit and received very little satisfaction by the sound of it, Duane.
Yeah, that's an accurate thing. Very little satisfaction, a lot of frustration, a real frustrating feeling when you know kind of what you're living with. And
nobody seems to get it.
Nobody seems to get it. And it's not that they necessarily don't care. Some of them really did and wanted to help and stuff, but the truth is they just didn't get it, right?
Okay, so now I'm sitting across the desk from your doctor here. So, Philippe, when Duane showed up at the clinic, and this is a pretty typical story in the sense that, as we've said many times already, NeuroKinetics tends to be the clinic of last resort. It's where people end up, they've gone around and around and around and no satisfaction. So Duane arrives at your clinic. And Sonia will walk us through the protocols of the intake. But once all of that was accomplished, how did you get started?
Well, after having collected all the data and information required to design the structured program we use to restore brain dysfunction, which usually are very commonly observed after concussion, a head concussion.
Right.
We discuss the situation with the patient, we debrief, and we present what will be the line of attack, if I may use that terminology.
Sure.
And and discuss the strategy, the treatment strategy. We think in terms of incapacitation. Symptoms are helping, but the loss of function is paramount.
Right.
in a case of concussion as it is in a case of any mild or severe traumatic brain injury.
Well, in Duane's case, the pain, particularly after he had a suitcase dropped on his head, got to the point where he couldn't go to work anymore. Exactly. So he shows up at the clinic, and this, I suppose, is an advantage in a strange way to Sonia and you, Philippe, because by the time a patient like Duane, who has already told us he's been to various doctors and sought advice from various sectors, by the time they arrive to see you, they've amassed quite a dossier. So they bring to you a fairly large amount of information.
Always. And we request that as well.
Okay. So how long, Duane, did it take for you, once you were speaking with Dr. Philippe, to figure out, hey, this guy gets it? I've been seeing all these other people, and nobody got it. And all of a sudden, I'm sitting across the desk from this guy, and darn it, he gets it.
I would say the first time I showed up at the clinic, Philippe and I had a discussion about my medical history and kind of the trauma I'd been through, the symptoms I was experiencing. And within minutes, I could tell that Philippe understood what I was talking about. Some of the symptoms, a little bizarre and stuff, he would explain them to me right away. He even led me down the path of saying, do you have these sorts of issues, and stuff that I hadn't even necessarily consciously even noticed. And he understood kind of the global picture, and it literally was within 15 minutes I understood that I was in good hands and that finally someone got what was going on with me.
What an enormous relief after 2 hours of going around and around and around, Duane, to sit down and to finally have someone who at least understands what the heck you're talking about.
Yeah, it was a landmark step, is to have that understanding. It was the real first step of my recovery, is to know that someone understood what was going on, and it provided, some relief and also some hope that, better days were ahead.
Well, that's an interesting combination too, isn't it, Philippe? The ability to provide to the patient, first of all, the knowledge, the information that here's what's wrong, and now here's what we're going to do to make it right. So it's both knowledge and hope.
Yes.
So how long did it take for you and Duane to organize his particular customized program?
It took three-step assessment, each session being between 3 to 4 hours of length, plus a couple of hours, up to a couple of hours of personal work outside of patient side. So hours piles up during the assessment, but it is a worthy time spent to understand what is going on.
Okay, and once all of the assessment is completed, and a pretty thorough diagnosis of the problem has been identified, then you can move on to the therapy, correct?
Exactly. Yes. Understanding is everything.
Sure.
Understanding for the practitioner, of course, which then is able to reverse engineer what the trauma has undone, and identify the limits to the recovery, if any, under the form of obstacles or under the form of damages sometimes, which complicate the picture. But understanding all of these whereabouts are key to do the right thing.
And Duane, as far from your side of the desk, coming into the clinic, and first of all, just experiencing the enormous relief that finally you're sitting opposite a medical professional who gets it, who understands what you're talking about, who's even suggesting symptoms to you that you hadn't paid any attention to because you were busy paying attention to other ones. So all of a sudden you're there going, wow, okay, so now we're going to have a couple of sessions in which all of my medical history is going to get discussed and all of that, and then we're going to organize a program. How long did that take before you were through the full assessment, Duane, and then got to your first actual hands-on therapy day?
The assessment was done over multiple days, and we did it pretty quick, and I think the treatment started roughly within about a week. Is that right, Philippe?
Yes, it is.
Okay.
Yeah.
And how frequent did you have to go to the clinic for treatments to begin with, Duane?
2 to 3 days a week I would go for about 3 or 4 hours. Well, about 3 hours at a time.
Okay. And what sort of exercises does one do, spending 3 or 4 hours a day, 2 or 3 days a week. What does one do during those hours in order to try and restore brain function?
Nothing.
Oh, really?
Yes. The patient is required to do absolutely nothing. It is all about medical stimulation, biomedical stimulation, acupunctural stimulation, and monitoring of what is going on from a physiological standpoint, most importantly from a brain physiological standpoint, and we are monitoring the situation and its evolution through measuring and assessing brain physiological parameters, general physiological parameters, psychological parameters, cognitive parameters, and so forth.
Okay, so Duane, that one couldn't have been too hard a mission to accomplish for you. I need you to show up and do nothing for 3 or 4 hours. Okay, Doc, I think I can handle that, right?
Yeah, that's right. I could definitely handle that. It was an interesting thing because one of the questions I always ask too is as you're healing or trying to get better is, you know, you got this in your mind that you should be doing crossword puzzles or exercising
exactly.
and those sorts of things. And one of the things that really helped as the treatment started was the ability to sleep, because one of the symptoms I had that's pretty common with concussions is I had a brain that was not operating the proper way. It was a little chaotic. It didn't like to shut down. I had a lot of trouble sleeping and getting good rest. So early on in the program, I started to be able to rest effectively for the first time in a long, long time, and that really kind of helped kick off the healing process as well. I think Philippe would agree.
Isn't that interesting, Philippe? Because one would think, and Duane certainly from a layman's perspective, I think articulates what most of us would do. Oh, my head hurts, my brain might be injured. But gosh, I better start doing some brain exercises, like Duane says, crossword puzzles, or I would watch Jeopardy twice a day. That kind of thing. Just work out, get that brain going. And you want the exact opposite. You want this brain to finally settle down.
Yes, and there's a good reason for that. As human beings, under the governance of brain controls, which I won't enter the details today for time questions, we are physical beings, we are cognitive beings, we are emotional beings, we are intellectual beings, and we are also, out of all of these, executive performers. Spontaneously, the brain is a very active engine.
Sure.
Constantly, and he will not ask you permission to do something.
Sure.
It is the mystery of life, part of what I call the mystery of life and survival. But when we get hurt, a lot of chaos will occur in the between the connections of those controls, and will, out of their losses or dysfunction or potential damage, but in any case loss of proper function, symptoms will rise. And this is why you, after such a concussive trauma, patients commonly, or we as human beings, commonly present simultaneously apparently unrelated physical symptoms, cognitive symptoms, emotional symptoms, intellectual symptoms, and executive disorders, which means we lose performance. The word incapacitation in traumatology is a key word.
Okay.
It comes, even in my eyes, before symptoms. Symptoms are alarm signals that say a lot, but incapacitation is paramount.
Duane, how long into the therapy program of allowing your brain to just breathe a little so you could catch a bit of sleep and all the rest of it, and so that even just being able to sleep somewhat normally, suddenly life levels off a whole lot. So how long did it take you to go through the program to the point where you achieved the sort of satisfaction you had spent 2 years trying to find unsuccessfully?
Well, I would say that I'd been struggling for even much more than 2 years.
Okay.
And after seeing Philippe, the results were basically instantaneous with the rest and the clearing of the mind, and the greatest results were probably early on, and then, after that time, I still had issues. I still had symptoms. Stamina was a big one.
But you were able to understand more about what was going on, I guess.
Absolutely, yeah. And understanding was a big thing because I'd had all these symptoms. A lot of them I didn't recognize were connected, like cognitive symptoms and physical ones that I thought were completely separate. So that understanding was powerful, where Philippe kind of unified everything together for me to understand that, this is real, this is substantiated by objective testing, this is what's going on with you, and this is the program that's going to help get you better, right? So
almost out of time here, Duane. How long did the program last, this intense treatment with Dr. Philippe?
I think we were around 14 weeks or so.
Okay. Several occasions per week over about 3 or 4 months.
Yeah, and the frequency and kind of intensity, the frequency for sure kind of tapered off as my health improved over time.
Great.
Yeah.
And are you still a patient, or do you make infrequent visits, or are you all better, Duane?
I feel much better. I still have a little issues and stuff. I don't live in Vancouver right now, so when I visit Vancouver and stuff, I definitely stop by for infrequent visits.
Good.
What I'd say is a little tune-up there.
Okay.
Yeah.
But all things considered, the experience of the NeuroKinetics Clinic and Dr. Philippe's approach has been an enormous difference in your life.
Absolutely. 100%. You bet.
Well, it's great to talk to you. Thank you so much for joining us today. It's Dr. Philippe and Sonia are both sending you just huge smiles. So their thanks to you as well, Duane. Great to talk to you.
Thank you,
You bet. My pleasure. Thanks.
There's Duane Anderson, a former patient, a success story, one might say, of the NeuroKinetics Clinic. In Vancouver, by the way, at 3195 Granville Street. That's in the Highcroft Medical Building, right there just at the bottom of the hill on Granville Street, heading down into the busy section of town. They're online, by the way, at neurokinetics.com, or, Sonia, the shortcut website, the easy-to-remember web address is?
renewme.ca.
renewme.ca. Back with lots more on Boomer Life after this.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CISL 650. We're back. This is Boomer Life on CISL 650.
With you on my mind. With you on my mind.
Welcome back to Boomer Life as we reach back to the 50s with you on my mind. A little Nat King Cole music. Sterling Fox in studio with Philippe Souvestre and Sonia Dale from NeuroKinetics Clinic in Vancouver. And we're joined on the line by Lorill Hancock, another, well, we can say NeuroKinetics success story. Lorill, thanks for joining us. Hello.
Hi, how are you doing?
Well, I'm fine, thank you. Yeah, it's good to have you on the program. Tell us a little bit about yourself. You're a professional person. What do you do for a living, Lorill?
I work in marketing at a nonprofit currently.
Oh, okay. What brought you to Dr. Philippe and the NeuroKinetics Clinic, and how long ago did you go there?
A friend of mine actually put me in touch with Dr. Souvestre over 3 years ago. And it was just fate that I found him at the timing that I found him. He was a huge help in my healing journey. So it was over 3 years ago, and it was a friend of mine that directed me to him.
Okay, now I need to know about the healing journey. Healing from what, Lorill? What happened?
Well, I was an active soccer player my whole life, and over 3 years ago, I just started developing symptoms that I couldn't figure out, didn't understand the cause of, including terrible headaches.
Mm-hmm.
And so this was all happening while I was working. Probably the worst headaches I've ever had in my entire life. And that lasted for a couple months before I found Philippe. And just a lot of, weird nerve dysfunction, brain fog, weird muscle-y stuff, and it was just a matter of time. I was being bounced around in the medical system, and, it was kind of traumatic, actually, and didn't really know where to go, but luckily I found them.
Well, as we're about to find in June again, we're going to be reminded many times over in June when the Women's World Cup of Soccer comes to Canada, we're going to be reminded, Lorill, in spades, that women's soccer is not a non-contact sport. There's an awful lot of contact that goes on, and a lot of women get injured, including you.
Yes, apparently women store their concussions a lot longer, and it takes them a lot longer to heal from any kind of brain injuries. And they're thinking about taking heading of soccer balls out of women's soccer altogether. So.
Is that right?
Yeah.
I'd heard about that in the context of children's soccer in the past, but not the women's aspect of the game. Interesting development. So what specifically happened to you, Lorill, that took you to a doctor in the first place? Was it an injury on the playing field? Did you get an elbow in the head and you saw red and that was the end of it? Did you get knocked out?
You know what? I think the verdict, the overall consensus is too many injuries and too many balls to the head. So it was just like a compounding thing of, years and years of injuring myself because it was pretty competitive soccer. So,
I'll bet. And so you said you bounced around the medical system a little bit. Explain that, please. And it's something that I'm sure we can all relate to, but tell us your story.
Well, I kind of just went on this tear trying to get rid of all these symptoms, not really knowing what was causing them. So I, visited the medical doctors, and, I visited a neurologist, and I really didn't have much help. They were kind of not helpful at all, actually. So you kind of have to explore other options at that point.
How did you find out about NeuroKinetics?
Well, they are associated with the charity that I now work for, and it was kind of like, I'm so surprised I hadn't heard of them before, but it ended up being a fellow colleague of ours that put us in touch. So
another one of those personal referrals, Sonia, that you're talking about.
Yeah.
And it's word of mouth. And what we're trying to do is extend the word of mouth just a little bit further here on Boomer Life by having people like Lorill show up, especially Dr. Philippe, and to tell the story from the patient's perspective about finding you and getting better. So, Lorill, when you finally found Dr. Souvestre and went to NeuroKinetics, what happened to you?
I spent about 3 months there, and initially it was so reassuring to find Philippe, and I did feel like he spent the time with me for the initial couple of weeks I was there, just trying to educate me and let me know what's actually going on with my brain and why it's doing these things. And he would spend hours with me, honestly, out of his own personal time, so I thank him for that. And honestly, at that time of my life, it was really when I needed somebody to explain things to me, because you're kind of in the dark.
Well, and isn't that spooky, Lorill? I mean, when you know something's wrong, you're just off your game. You're absolutely certain that there's something wrong. You start seeing medical professionals, and you get no satisfaction. You don't even get to know what's wrong, but you know something's still wrong.
Right.
And finally, you sit down across from a person who goes, I know what you have. And then, Philippe, I guess you would just start going through the list. Do you experience this? Has this happened to you? And so on. And that's all part of those 3 assessment meetings, correct?
Correct.
So in Lorill's case, how long did it take you to develop an understanding of her circumstances?
Well, it took a similar amount of sessions that were mentioned in the previous segment of this show. But the methodology used was different, as every patient's experience is quasi-unique.
Okay. And I suppose, Lorill, though, in the absence of information and a growing degree of frustration in your life, the information, the knowledge, first and foremost, that, well, I understand what's going on, and here's what it is, and here's what we can do for you. What an enormous relief that must have been all by itself.
Yeah, it was huge, actually.
And how long did it take from getting that important knowledge to developing and entering into a program of therapy where you actually began to aggressively get better?
Well, we started pretty quickly after I was assessed at the clinic, so it was right away.
And how long did your particular program last, Lorill, and how many occasions per week were you required to come to the clinic?
I was there for 3 months, and I was there on average maybe 2 to 3 times a week.
Okay. And during that time, over the 3-month period, did the frequency stay the same, or as you started to get a little better, were the occasions reduced?
I think the occasions were reduced, depending on, the symptoms, for example. A lot of things like, for example, the anxiety went down a lot. I feel now, looking back in hindsight, and just the mobility and some of the soft tissue injuries and some of those things, like some of the pain diminished, definitely the headaches. So, yeah.
And was this...
What I got there?
I was just curious, Philippe, when you sit down with a patient like this and you know what's going on and you ask all the questions and you do extensive intake analysis and assessment, and once you develop that program for that individual, how closely does that person need to follow the program after finishing the clinical part with you on a weekly or daily basis? Are there post-clinic exercises or activities to continue to repeat to ensure brain health?
No.
Oh.
No, not at the beginning anyway. The reason is the brain functionality after such a trauma in general is very diminished and decreased, and the brain is actually busier in trying to compensate what is no longer working well.
Mm-hmm.
You know, it is a live engine, if I may say, and a lot of processing will be developed and spun up a little bit, enhanced to compensate what is missing. So that explains the fatigue, physical fatigue, explains the cognitive fatigue, and explains the emotional fatigue.
Right. Right. And I suppose, Lorill, in your case, as would be the case with anyone who's experiencing and knows with certainty that something's wrong, but unable to identify it and unable to have medical practitioners assist in identifying it, gets a little scary after a while, doesn't it? It's beyond weird. It starts to get scary.
Oh, it was hugely traumatizing. I'm not going to lie. 5 months of just unknowing and, having scans and everything coming back negative. Like, you just don't even imagine that something like this could happen to you. But it can, so.
And in your case, I assume you started playing soccer as a little girl, right?
Yeah, I was 8 when I started.
Okay, and so do you still play?
Heck no.
Enough already. But you
I retired.
A very active, very athletic, a very competitive person who played organized soccer for decades.
Right.
And so this trauma, Dr. Philippe, that Lorill came to you with was basically an accumulation of years of small traumatic events.
True. And there's a name for this. There's a name. As far as it relates to the concussive phenomenon, we call that complex chronic post-concussion syndrome.
Okay.
So there's a name. There's a larger entity which includes that along other modalities, which is called the postural deficiency syndrome. And this paradigm is totally unknown in North America.
So Lorill, when you found out you had traumatic post-concussion syndrome, even though you perhaps didn't understand what it meant, and nonetheless, you had an identification. Somebody went, this is what's wrong.
Mm-hmm. Yep. I needed that.
Well, wouldn't we all? I suppose it's the uncertainty, and Dr. Philippe, you keep coming back to this. Information is so important to the brain-injured person. They have to understand what's wrong before they can begin to get better.
Understanding is everything.
Right. How you doing these days, Lorill?
I'm back at work. I've been back at work for about a year and a half now. I'm definitely not playing soccer.
Okay.
I'd say I'm 70% there, but I know that the brain takes time to heal, and I'm doing everything I can on the side to help that along.
I would like to complete what I just said. Understanding is everything, but is not sufficient.
Right.
To heal.
Oh, okay. So in Lorill's case, she says she feels about maybe 70% completely recovered, and understanding that there is a time requirement here. Is it possible for a brain-injured person like Lorill to achieve 100% recovery?
Potentially, yes. In a sense, there is no limiting damage that would prevent full recovery.
Okay. So but then it's a process, isn't it?
It is a process,
okay.
Yeah. Because even damaged tissue may, through time, repair and heal.
Okay. Yeah. Lorill, I'm delighted to hear that you're okay and feeling well and have benefited as hugely as you clearly have from NeuroKinetics.
Yeah. definitely.
Well, thank you for joining us. It's really nice to have you on the radio. And say goodbye to Sonia and Philippe here, if you want.
Thank you, Lorill. Bye.
Thank you for sharing, Lorill.
All right. There's Lorill, another success story from NeuroKinetics. We'll take a quick break here, and we'll talk a little bit more about concussions and treatment when we come back on Boomer Life.
Celebrating the baby boomer lifestyle. This is Boomer Life on CISL 650. We're back. This is Boomer Life on CISL 650.
You lay so easy on my mind.
A little Roy Orbison there as we return on Boomer Life. Our guests in studio from NeuroKinetics Clinic, Dr. Philippe Souvestre and clinic manager Sonia Dale. And Sonia, we've heard from a couple of success stories, former patients of NeuroKinetics, and they've referred to, and Dr. Philippe has done so as well, the process by which people meet him and are admitted to the clinic and so on. But we've only received bits and pieces of it. So walk us through what happens. We're listening to the radio. These people sound like they know what's going on. I love those patients. They sound like me. I would like to talk to that Dr. Philippe and maybe get in there and get plugged in. What do I do?
They can either send us in an email or call us. Either or form of contact. At that point, what I will do is any one of our team members will give them an email back or a phone call at whatever they note down is their best form of contact.
Sure,
so like us to give us a call back. At that point, what we like to do is initially do a consultation, which is a complimentary service we provide to them. Just getting to know their feelings, getting to know their symptoms, getting to know what we're working with on hand. We get anywhere between symptoms of, I'm feeling broken, I'm confused, I'm frustrated, feeling foggy, feeling depressed.
Feeling afraid, I'm sure, too.
Fear is a main thing.
Yeah, I'm sure.
Yes.
Okay.
Yes.
So is that a face-to-face or is that on the phone?
We love to do it face-to-face.
Okay, all right. So that's number one.
That is number one. Reason being we like to do face-to-face is we want to ensure that they feel comfortable.
Okay.
Mainly with Dr. Philippe and mainly with the team there. If they're getting treated, they have to feel comfortable with the doc,
Of
right?
course, absolutely.
Yes.
So and when do these assessments, is that considered one of the 3 assessment gatherings then?
No.
So that's the preliminary, and then occurs the 3 assessment meetings.
That's correct.
Okay. And what happens after that?
After the 3 assessments, so what happens with the initial first assessment is when all the information is taken and gathered to move on to see if they do, and what I like to say is graduate on to the level 2 and the level 3 assessments.
Okay.
Okay. So if they do and the triage of assessments are completed, then at that stage, the customized treatment program does begin for them.
Okay. And Philippe, you are developing these treatment programs as the assessment. It's always a work in progress, isn't it?
Yes, it is.
Okay. And then the program or the treatment program, Sonia, lasts as long as is required then,
That's
right?
correct, yes.
Okay.
Yes.
Dr. Philippe, we don't have a whole lot of time left. We appreciate yours today, and I think it very reasonable to say that though we had intended to devote this hour to the matter of concussions, we really have only scratched the surface. We must do more of this. It's an incredibly deep and expansive subject. I thank you for allowing us to understand a little bit, and I insist that you return and give us an opportunity to understand more.
It will be my pleasure.
Okay. And let me give you some information. The NeuroKinetics.com is the website, but Sonia's got a shortcut.
I do. It's renewme.ca.
Renewme.ca, and the phone number is 604-RENEW-ME.
Yes.
Or 736-3963. You can get it all on the website, renewme.ca, which will lead you, of course, immediately to neurokinetics.com. Dr. Philippe and Sonia, nice to see you again.
It was a pleasure being here.
Very, very interesting hour.
The
Thank
same
you.
here.
And we'll see you next time, right here on Boomer Life.